We need to change in some fundamental ways our mental models if we're going to put together a response that's equal to the challenge, and in this case, it's pandemics. One of the mental models that I have been working to change for most of my adult life is low aspirations for the poor, especially in healthcare. The students who are undergraduates don't even remember a time when the threat of HIV was the scariest thing on earth. And so there were millions of people, some 25 million people infected. And when we raised the notion that because, in 1996 was when we started having real drugs, the so-called highly active antiretroviral therapy that transformed HIV from a uniform death sentence to a manageable chronic disease in the rich world. That was 1996. But by 2000, still, people were very, very worried and couldn't get it in their heads that you could have this treatment and make it effective in Africa. A high-ranking U.S. government official said that many Africans don't know what Western time is. You have to take these AIDS drugs a certain number of hours each day, or they don't work. Many people in Africa have never seen a clock or a watch their entire lives. And if you say 1 o'clock in the afternoon, they don't know what you're talking about. They know morning, they know noon, they know evening, they know the darkness at night. Now, this person had visited Africa just before, and the African dignitaries who had been with him said that the only one who was late for every meeting was him. Right? But you can hardly believe it, right? Everybody was saying that it's impossible to treat HIV in Africa. Now, here's another one. It's so politically incorrect to say this, public health official says, but we may have to sit by and just see these millions of already infected people die. He said this, acknowledging that this was an option that would be considered unacceptable in the developed world. Very few public health professionals are willing to take on the AIDS activists by saying that, but a lot of them talk about this in private. Right now, and for me, I was going crazy because once again, the justification for not treating HIV was that it was too expensive. A full year of AIDS medicine at that time cost about $10,000. And they said, just do the math, 10,000 times 25 million people, not affordable. But I came in, and many of us came in and said, but wait a minute, these medicines are still on patent, but the research-based pharmaceutical industry makes almost no money in Africa. So they're not actually losing market share if they were able to do some creative things, give licenses over to companies in India, and reduce the price. So still, they would say, yeah, but you're taking attention away from prevention. There's no infrastructure to get this done. It's crazy. But then we started asking, what would it mean for us, even though we know there are medicines that can keep people alive indefinitely, what would it mean for our entire generation to say to those 25 million people, I'm sorry, but it's inconvenient for us to treat you, you're all dead. I'll tell you right now that if we did not start HIV treatment in Africa, I cannot conceive of how Africa would have had the growth rates it's had over the past 15 years. Back in those dark days of 2000, very few people knew their HIV status because they knew that getting tested would only subject them to stigma and they would not receive treatment. So just the opportunity of treatment, we thought at that time, would change things. Now, how did we change people's mental models? One of the great, great heroes of the HIV treatment revolution, and someone who's still remembered very fondly in most parts of Africa, is President Bush. Because he made a very strong argument morally that we should try to treat the poor. And I don't know if any of you remember, but it was in January 2003 at the State of the Union address where President Bush made this historic announcement. And one of the things that we had done, Paul Farmer, my longtime colleague, took these photos to the White House to show them. Because this is what people with HIV used to look like. People with HIV in the United States used to look like this. This is Joseph June. He's from Haiti. And we found him. He came to the clinic. He was carried by his mother, who is holding his arm there, but you can't see her, and his relatives. And they said, we don't know if you can do anything for him. And we found that he was suffering from both tuberculosis and HIV. We treated the tuberculosis first and started him on HIV medicines. But in that first encounter with healthcare officials, the mother quietly pulled Paul over and said, what I'd really like is some help for money for his coffin. So, a few months later, this is what he looked like. We called this the Lazarus effect of HIV treatment. You guys never see this anymore. You never see this kind of transformation. But what I did in 2003, right around that time, I was working at the World Health Organization, and we put these before and after pictures in every document. And it was these before and after pictures went all over Africa. Now, I have to say, unfortunately, that even in 2003, many of those people who were very cynical and negative about HIV treatment remained that way. But these pictures had a huge impact in Africa. Something happened, and it happened first and foremost, I think, among Africans. And it wasn't just this picture, but it was this fundamental sense that this was not a question of cost effectiveness. This was not a question of whether it was doable, whether there was the infrastructure. For President Bush, he did not know at that time that, one, it could be done, and that, two, it would have such a huge impact on the economic prospects of Africa. This was in the face of a powerful, predominant mental model that said that these complicated things are just not possible in Africa. Could a huge pandemic happen tomorrow? Yes. On top of Ebola? Yes. Could extreme weather events happen in a way that just destroy communities and plunge people into poverty? Absolutely. What I have tried to do by giving us a target, 2030, end of extreme poverty, boost shared prosperity, by giving us measurable targets, I hope that what we have been able to do is change people's conception of time. And I think nobody understood this as well as Martin Luther King. In his book, Why We Can't Wait, he tells about a white moderate who wrote to him in jail. And the white moderate said to him, "All Christians know that the colored people will receive equal rights eventually. But it's possible you are in too great a religious hurry. It has taken Christianity almost 2,000 years to accomplish what it has. The lessons of Christ take time to come to earth." To which Martin Luther King responded, "Such an attitude stems from a tragic misconception of time and a strangely irrational notion that there's something in the flow of time that will inevitably cure all ills. Actually, time itself is neutral. It can be used destructively or constructively. More and more I feel that the people of ill will have used time to much more effectively than the people of goodwill." And he ends by saying, "We will have to repent in this generation, not merely for the hateful words and actions of the bad people, but for the appalling silence of the good people." We hope that all of you will join us in what we hope will become a movement to end extreme poverty on this earth. You are the first generation in the history of the world that can end extreme poverty in your lifetimes. I hope and I expect that we will all work together in accomplishing just that.